first, let's explain what is Medicare Advantage and how is it funded?
So Medicare Advantage is a part of Medicare where beneficiaries have a choice of private insurance plans. These insurance plans get paid by Medicare to cover beneficiaries. About half of all Medicare beneficiaries are now enrolled in these private insurance plans. So we pay for Medicare Advantage through Medicare Part B premiums and the Medicare Part A Hospital Insurance Trust Fund, which, as I'm sure you know, is approaching insolvency in the next 6 years. So that's one of the reasons why we're so focused on Medicare Advantage reform, because doing so can extend solvency, can reduce Medicare costs over the long term, both for the federal government and for beneficiaries who pay higher premiums than they should have to pay because these Medicare Advantage insurance plans are actually overpaid by the government to cover Medicare beneficiaries.
Yeah, one of the interesting things is, when Medicare Advantage was introduced a couple of decades ago, the idea was to have a program almost as an experimental thing that would have competition, would have healthcare plans competing for a basket of services for a set fee, and that was supposed to help drive down the cost of healthcare and establish that it can be done and be more cost efficient than traditional fee for service. So how is it ending up that Medicare Advantage is being much more expensive than fee for service?
Yeah, this is one of those really crazy things. And I think the thing that makes me crazy about it is that we actually did find out that these private plans can save money through efficiency and network management and all of the things that commercial insurance plans do, that they can actually treat Medicare beneficiaries more cheaply than traditional fee-for-service Medicare. But over time, the government has overpaid these plans to where they're now making a profit and gaining members, not through those efficiencies, but through these overpayments. And that means over time, the competition has become kind of an unfair competition between private insurance plans that are now paid more per beneficiary than it would cost to treat them in traditional fee-for-service Medicare. And in fact, we have never saved money from having managed care in Medicare because of these overpayments. And I think that's something that is maybe surprising to the American public. It's definitely surprising to members of Congress who thought we were setting up this competition to become to make Medicare more cost efficient, and we haven't done that. So I can go into the reasons why we're overpaying them or what some of the culprits are.
Yeah, I think that would be.
Yeah,
I
the
mean,
overall problem is really very basic and problematic going forward.
Is the problem just one of Medicare Advantage plans learning how to game the system to get higher payments?
Yeah, I think they have gamed the system. They've gamed the system not because they're necessarily bad actors, but because the incentives all point Medicare Advantage plans to gaming the system. So here's how it works. We set up a program where we don't want Medicare Advantage private insurance plans to pick all of the healthy individuals in the Medicare population and leave the sick to traditional fee-for-service Medicare, because that would increase costs in traditional fee-for-service Medicare. So we set up a system of risk adjustment, which all good insurance systems have. The only difference is, unlike risk adjustment in the Affordable Care Act or in Medicaid or among different payment models in fee-for-service, in Medicare Advantage, that risk adjustment is not budget neutral, which means you can get more money by treating sicker patients, but you don't lose money by treating healthier patients. So it's additive. And these insurance companies have figured out a way to game the risk adjustment system to make more money where it looks like they're treating sicker patients than fee-for-service Medicare, But all of our available data is that Medicare Advantage beneficiaries are not sicker than fee-for-service Medicare, and there's even some evidence that they might be a little bit healthier, but we're paying those plans as if they're sicker, which is kind of the underlying problem behind the overpayments. There's also one other way we're overpaying these Medicare Advantage plans, and that is we decided to do quality bonus payments to Medicare Advantage plans that had high ratings on a 1 to 5 star system, because we want CMS to reward insurance plans that do a better job with these extra payments. And we also want to have some measure where beneficiaries can look up whether the plan they're buying is highly rated or not. The problem is Medicare has graded on a curve, and now 90% of all plans are either 4 or 5 star plans and getting these quality bonuses. And if everyone is excellent, 4 to 5 stars, then no one is excellent, 4 to 5 stars, and beneficiaries don't get good information about what a good insurance plan is over a bad insurance plan. And yet we're still funneling lots of money, extra money into Medicare Advantage to reward these quality bonuses, which are basically at this point meaningless. Another place where you would want to see budget neutrality, where the poor plans got less, the good plans got more, but that it was all budget neutral and balanced out. Instead, again, we're throwing money on top of money and overpaying the insurance plans.